That's perfect. So hello everyone and welcome to our session today, Bridging the Gaps Between Policy, Coalface and Data Science in Crisis Situations, organized by the RDA CoData Data Systems, Tools and Services Working Group. And as you might have noticed, the recording has started. This meeting is being recorded and the recording will be shared after the plenary. This meeting also adheres to the RDA Code of Conduct. As a reminder, I will post the link in the chat shortly. We do have collaborative notes that have just been shared in the chat. I will share this link regularly throughout our session. With this very brief introduction, I would like to welcome to the stage, virtual stage, Stephanie Kiegers, co-chair of the working group to start us off. And many thanks everyone for joining. Thank you.
Thanks, Athena. That's great. There's also, I've got a shortened link to the collaborative session notes on every slide pretty much. So even if you can't see it in the chat, that's another option. Okay, this is one of the RDA slides. So just a reminder, each RDA member complies with the 6 guiding principles: openness, harmonization, community-driven, non-profit and technology neutral, inclusive and consensus. And there's a lot of information about this on the RDA homepage still, I hope. Again, collaborative session notes. And other than that, I would, before we start, like to acknowledge and celebrate the first Australians on whose traditional lands I am at this point. And some of my other Australian colleagues are on different traditional lands. In my case, it's the people of the Kulin Nations because I'm in Melbourne. And I would like to pay my respects to the elders past, present, and emerging. We have a reasonably small group here. I was wondering if each of the co-chairs could potentially just say one sentence about who they are, where they are, and basically who they are and where they are, if that's okay. I might start. My name is Stephanie Kiegers. I'm a program manager with the Australian Research Data Commons in the area of data challenges. And as I said, I'm in Melbourne, Australia. Borchak, you're the next on my screen. Would you mind just saying one sentence?
Okay, hello, good morning from Ankara. I'm Borchak. I'm based in Ankara, Turkey, and I'm part of RDA CoData Working Group and also CoData ITPC and CoData Crisis System and Tools Services, and happy to be here. Thank you.
Thanks, Borchak. Francis, just one sentence.
Yeah, thank you. I'm Francis Corley from Leuven in Belgium. Very happy to be here with everyone.
Thank you. Nana?
Hi, I'm Nana. I'm with ARDC, Australian Research Data Commons. I work as AIML Research Data Specialist. We're happy to be here.
Okay, and may I also ask Jackie, one of our lightning speakers, lightning talkers, is that a word?
Hi everyone, my name is Jackie Stevens. I am an Associate Professor of Public Health at Flinders University in Adelaide, South Australia. Thank you.
And Athena, do you just want to say one sentence, given that you're our wonderful Tiger support?
Of course. Hi everyone, I'm Athena Papadopoulou. I'm RDA Europe's Science Officer. And I'm supporting the working group under the Tiger program.
Thank you very much. So let's get to the aims of the session. So what we want to do here is to talk a little bit about the working group to people who may not know much about us, celebrate a little bit what the working group has done so far. We want to also get some work done for the working group, possibly identify pieces of work, recruit some more active participants, and potentially, if that makes sense, set up task groups to address further pieces of work in the working group. But if you just want to listen mainly, you're welcome for that too. So don't feel like you have to be put on the spot. Just a bit of housekeeping. Please sign into the collaborative notes document, just so we know who is here, was here. And yeah, we can go from there. So the agenda looks extremely full, unfortunately. So it's not as scary as it looks. So first of all, we'll do a bit of an introduction to the working group and what we're trying to do with it. Talk a little bit about what we've done. Then hopefully we will have a bit of a group discussion. The first thing we'll do is to set the scene as we have 3 lightning talks, one of which is a recording from a policymaker in this context. Then we have Burchak talking about a data scientist perspective, and we have Jackie, and yeah, person on the ground sounds a little bit weird, but that was the best we could come up with, who will be talking about exactly that. So we're looking at crisis situations and data needs from 3 different perspectives, basically. And then we have a couple of discussion questions that we came up with. So what can policymakers learn? What do policymakers need from people like data scientists and people on the ground to make decisions in and around crisis situations? What can we learn from data scientists that can be shared with policymakers? What are data gaps for people on the ground that make decision making in and around crisis situations harder or easier? Well, data gaps probably don't make them easier, but what are things that you can have that would make your life easier? If you have any other questions you would like to bring up, please feel free to add them to the collaborative notes document. And also, if you're happy to just put them into chat so we can get to that discussion a bit later. And then we'll do a wrap up and some next steps. So this is just a page that it's going to be shared as the slides, so there's nothing exciting here. It's just the group page, and I think Athena might be able to put the link to the group page into chat. If you haven't joined the group, you can join it there. And there's also the link to our case statement if you would like to have a look at that at some point. So I've talked about the aims of the session. What are the aims of the working group? So what we try to do is assess the digital tool needs of key stakeholders during crisis situations and what the challenges are for them. We want to look at 3 different case studies describing these in more detail in specific areas. And we also want to develop a final recommendation, as all RDA working groups need to do. And in our case, we want to specify the characteristics of data systems, tools, and services that are required by stakeholders in crisis situations. So stakeholders can include people like policymakers, data scientists, and people on the ground. But there might also be others that we haven't even thought about. So if you have any input into this, that would be great as well. A bit of background. So there was at first an informal meeting that was held at the RDA Plenary 20 in Gothenburg in, I think it was March 2023. That brought quite a few of us together. Then we had a we basically developed the working group case statement over a period of March to June, probably a little bit later. I think the final version was August. There have been discussions outside of RDA and CoData in UNESCO, the International Science Council, within the UK Health Security Agency, and others. We have a fairly lengthy list in our case statement for all the other organizations and places that have had discussions. The working group was endorsed by the RDA in October 2023, just in time for our plenary session at Plenary 21 in Salzburg, I think. And I've just put in the links to the notes and slides. Again, that's just background information for later if you're interested. So that's a bit of a potted history, if you like, of this working group. Okay, Francis, would you like to talk about the connection with the CoData and UNESCO as well?
Yeah, thank you, Stephanie. Yes, so several of us are here, Nana, Stephanie, Burchak, Jackie. We're also members of a UNESCO CoData working group on data policy in times of crisis facilitated by Open Science. And this is a working group that got off the ground, maybe a year ago now, following first a meeting in Leiden and then a meeting at UNESCO in Paris. And what the context for this is the UNESCO 2021 recommendation on open science. So what we're doing is to create some guidance documents for scientists and for policymakers with regard to the use of data for addressing crisis situations, the preparation for crisis situations, the response to crisis situations, and the recovery from crisis situations. So we have this working group already going on. And as you can see in the title of the working group, it focuses on policy. And so we'll contribute policy documents, a guidance for scientists, a guidance for policymakers, as well as a fact sheet and a checklist that will go to the UNESCO toolkit. And if you just type into your search UNESCO Open Science Toolkit, you'll see right away what it is. You'll see that there are other policy documents there, guidance, fact sheets, and checklists there. And we contribute one on using data in crisis situations. So that's the context there. And I think that what we try to do here within this RDA and CODATA working group here is to try to move from policy into tools, so data systems, tools, and services. So actually to get into somehow a relationship between the machines, the software, the mechanics of data, together with the policy of data, and put these together here. So our focus really is on digital tools that are needed by the scientists, policymakers, and communities, importantly, in addressing the preparation for mitigation, responsive, and recovery to crisis situations. And so really what we want to do is to see the relationship between policy and systems, tools, and services, and try to transform policy into systems, tools, and services. I hope I said that somewhat correctly, Stephanie, and I didn't get it too wrong.
Sounded good to me. Okay, before we move on, are there any questions at this point? Please feel free to unmute and speak up or put them into chat if you have any questions. Okay. If not, I shall move on. So, okay, so there's a question from Bruno, how to categorize the crisis items?
I think Burchak can answer that question best.
Okay, thank you. I also put in the chat the link while Francis was talking to the working group on data policy in times of crisis under CODATA, and Graham and Alison is also here, Nana too, who are members of the team. How do we different every emergency, every disaster is an emergency and crisis, but not every emergency and crisis doesn't necessarily turn out to be disasters. There are some thresholds internationally recognized. You can find them like the number of deaths. If it goes beyond something, exceeds some threshold, then we can call it like categorize it like a disaster catastrophe. But anything urgent, like a flood happening is a crisis, an earthquake happening is a crisis, a tornado twister happening, a typhoon, a ship sank is a crisis. So a huge number of human flow is a crisis, but it depends. There are international standards and thresholds which define the category and level of it. So you can find it in MDOT, Emergency Management Database. If you Google for EM.DOT, Emergency Management Database, there's some information about it. I hope it helps. Thank you.
Maybe you should say something about the Sendai framework here too, Butch.
Yes, the main policy document, like everybody, like almost 192, if I'm not mistaken, signatory countries at very high level exists. So it is with the United Nations Disaster Risk Reduction Initiative, UNDRR.org. If you Google for Sendai framework, it is a valid documentation between 2015 and 2030. So the 2030 is the deadline, like every country enters in the system what they have been doing past year, previous year on to reduce disaster risk, emergency and crisis damage to any country. So there are some indicators where countries need to go into the monitoring system and take for it if they had accomplished their mission that year. So Sendai framework is the main document that we refer to as disaster scientists. Thank you.
Thanks,
Francis,
Bojack.
for putting it in the chat.
Yeah, thanks, Bojack and Francis. So just very briefly, what we have done so far. So the working group, as I said, got endorsed. We also have support from the RDA Tiger program. And if you are running a working group, I strongly suggest you look for the same, because it's been very great to have the support from Tiger. We held our first working group session. We have now defined the 3 use cases we will be looking at, and that will be COVID, cyclones, and earthquakes. We also, well, not we, but Nana mostly did a pilot mentoring program to show the feasibility. And Nana, do you just want to say a sentence or two about that?
Sure, thank you. Thank you, Stephanie. It just, I mean, it's not me alone. Several researchers at UTS, University of Technology, Sydney, mentored a group of students over a 3-month project in 3 groups, totally 9 students. They came up with 3 projects, all of them involving AI and machine learning applied to existing open source data sets to either identify crisis or support a crisis situation. These were proof of concepts. And the very purpose of this exercise was to see the feasibility of setting a pilot mentorship up fairly quickly, and also to demonstrate that it could be replicated elsewhere. And so that's a key purpose. The output is a bit more technical than the policy. So in the second round, we are looking at how you could actually take the learning from this and maybe translate that into some sort of requirements for policy. But we haven't found the students for it yet.
Okay, thanks, Nana.
That's in a nutshell. And you will find the project page in the mentoring pilot hyperlink. That was from last year.
Okay, thanks, Nana. And the final thing we wanted to flag, even though it's not 100% finished, but nearly, is we've been working on a survey about digital tool needs and challenges for key stakeholders during crisis situations. That's been led by Bojack. So if you are interested in helping us with testing that survey or with distributing that survey, in particular, if you have any contacts that would be interested in filling something like that in the areas of COVID, cyclones, or earthquakes, please, by all means, let us know. We'd be very, very grateful for that. We have a list of people to send the survey to, but more is always better. At the moment, it's a little bit Australia and Europe. Well, mainly Australia heavy, I think. So if we get more people, and also if we get a couple of people to test the survey other than us, that would be wonderful. Okay. And then Francis, if you want to talk a little bit about these achievements.
Yes, I think it's just some markings along the way, the pathway that we're doing. But we had a session that we were able to hold at the United Nations Macau AI conference this past April 25th. This was on developing UNESCO toolkit for open science policy for data and AI in times of crisis. I think what's really interesting, we had a very good session there, which relates very much to the work we do here. But I also think what's interesting there is that the United Nations Macau has established at that conference on the 25th of April an AI initiative. That's what they call it. But it's a really large international initiative that's just starting. And I think there's a lot of expertise there within that initiative, as there is at the UNU in Macau now as well, with regard to crisis situations, with regard to the use of data, and the use of AI technologies there. There's some very interesting work that's being done, particularly with LMICs, with very specific projects that we'll be undertaking. So I think that's something also that we might be able to connect to as we go forward too. And then also we were able to hold a session at the United Nations just recently on the 8th of May with their science, technology, and innovation section there on science in times of crises, where we had a number of people participating. And in fact, they published a policy brief with us there. And I'll put the link in the chat for you on that. And then I think this is one of the most interesting papers that's been published by Lili Zhang. My name is there, but I'm not important there. But Lili, this is really Lili's work together with Burchak and Alif and Virginia and her colleagues, other colleagues as well, really, and they put together this idea of protect, and under protect, they have essential elements in managing data policies. And I think that's a really good document for us to look at and try to understand. So yeah, Stephanie, I think we are moving along and we are getting some context here. And I think we're putting together a good framework in which we can do this work together with our RDA colleagues. So thank you.
Thanks, Francis. Okay. So again, are there any questions at this point? As I said, feel free to put them into chat or just speak up. If not, Athena, would you mind organizing to play the video, and I'll stop sharing.
Okay, so do let me know if you can't hear any sound, but it should be fine. And this is the presentation of Stephen Riley from the UK Health Security Agency.
Hi there, my name is Stephen Riley. I'm the Director General for Data Analytics and Surveillance at UK HSA. I'm sorry I can't be with you in person today, but I'd like to introduce one of the examples for your discussion today. I've been with the UK Health Security Agency since October 2021. I'm seconded from Imperial College in London, where I am a Professor of Infectious Disease Dynamics, and I've worked mainly on respiratory pathogens. I'm going to give a quick review of some work that we've done to address a clear need for data analytics within government. And I'll talk at the end a little bit about how that fits into the idea of open science and open data. And that's something that I am passionate about, and I've contributed to a lot in my academic work as well as the work at UKHSA. This project isn't directly in that lane yet, but I'll talk about that a little bit at the end. So, and the title of what I'm talking about is the use of respiratory virus forecasts to inform decision-making during winter pressures in the English healthcare system. So over each of the periods since spring 2020 up until winter 2022-23, there's been really high demand on the healthcare system in the UK during the winter. Knowing what that demand is and what's coming enables the NHS to effectively share resources across regions and pull in other resources if required. The key things that planners need to know is how many patients are going to arrive and when they leave. And if we can help support with numerical forecasts, then that potentially makes the job of planning easier. And a quick comment on forecasting in general. Everybody who is responsible for meeting a need at a future time will forecast in some way, perhaps implicitly and probably not numerically. But if your job is to manage something that happens in the future and be responsible for meeting a need, you're constantly forecasting your ability to supply the product, the activity, and what the demand might be. What we're talking about here is the potential usefulness of data and analytics to give numerical support to that forecasting exercise. And the time frame that we landed on to help support these decisions was just 2 weeks ahead, which essentially is kind of the shortest period that we think is still really quite useful, and therefore allows us to trade off to get the most accurate possible forecasting. So what did we do? We created a suite of models which used some leading indicators to predict the next 2 weeks of hospital admissions and occupancy at the trust level, and we could aggregate those up to regions or to national. We used pretty close to best practices to run each of those models efficiently over the season and to continually refine and communicate the forecast. And there's an example on the right-hand side of this chart. In the kind of now standard forecasting format, where the observed data are the points, the uncertainty associated with those data is shown in the kind of the dark shading, and then the current forecast and each of the previous forecasts are shown as the cones, where the line is the central forecast, and the area around those lines is the cone of uncertainty. You can see that for this forecasting of influenza bed occupancy, 14 days out, the forecasting was pretty good, but uncertain at certain times. We delivered a lot of forecasts. We had to overcome some challenges in the data, and we also use multiple models, which is there is a reasonable amount of theory now to suggest that there's normally 2 or 3 models that you want to employ during any one season, at least, in order that you can kind of hedge under certain conditions when one model is better or worse than another. And an example of a model here might be one model might use Google search trends as a predictor of future occupancy, which is more accurate sometimes than others. And in terms of the actual seniority that we delivered this in over the last couple of seasons, this is probably the first of its kind at this level in the UK. The impact, the feedback is that it did directly support decision making at a national level. And the most recent winter period was actually less demanding than the prior 2 winters or than the initial wave of the pandemic, substantially less demanding. And during those winters, a similar approach led to directly informing key decisions about what contingency may be taken for the next 2 weeks. These forecasts at a regional level enable the proactive management of resilience systems, risk rating, and coordination of mutual aid. And you can see an example of the regional output on the right-hand side here, where we try and communicate the results of the model in a really clear way, with a prediction of either going up or going down or staying the same, and then a confidence in that conclusion with the strength of the color. So the dark color, dark blue, is confidently going to go down. Light blue is probably will go down. So I think that's probably all I'd like to say about the details today. I hope that gives you an illustration of the type of work that we do. That's just one example. And more generally, this is very similar to a lot of the work done during the pandemic, which was done with open code by academic groups and was using the fully open data on the dashboard. We chose to discontinue the COVID dashboard because it was a pathogen specific solution and was quite difficult to maintain. But we have stepped up a replacement, which includes data from multiple pathogens. And we're looking around the world at different forecasting challenges that are stood up at the moment, COVID, flu, and other challenges, and that are being run in the public domain. And we're expecting probably to join those or to try and create some kind of open public forecasting competition in the near future, either perhaps contribute to the European effort or to try and create one of our own. We're a little bit negligent on the global stage of forecasting at the moment. Anyway, I hope there were some interesting ideas there. Again, sorry I can't be with you, but I hope you have a very productive meeting.
Thank you very much, Athena. I think we'll probably go to the next talk. If you have any questions about the talk by Stephen Riley, who can't be here, and his colleague Virginia Murray can't be here either, feel free to put them into the collaborative notes document, and we're happy to take them along. So happy to try and get answers if you have any particular questions. Okay, the next lightning talk will be by Boczak, and I think I'll be sharing your slides, which I should probably do at this
Please,
point.
thank you.
Let me just see, it's the wrong window. Let's try that. Does that look okay? Sorry, of course, not your slides yet.
There we go. Thank you so much. I will talk about, because it is still vivid. It has been 15 months. 15 months is a number. 15 months, a year and a half almost after the February 2023 Maraş earthquakes in Turkey, Syria earthquakes that happened last year. So we definitely knew before. We need, I'm a statistician. I'm a professor of statistics at Middle East Technical University based in Ankara. So I'm a statistician who works in disaster risk management and disaster risk reduction since 1999 Marmara earthquake. So 25 years of my lifetime has been dedicated to use data and produce policy. How to understand data so you make life easier and better, for safer and resilient for other people everywhere in the world who are disaster hazard vulnerable. So we need definitely data beforehand. We need data during. This is what we are trying to do with the UNESCO project that Francis mentioned about. And we need data afterwards, because, as I said, 15 months passed. There is still some data in the field. We will still need data from the beginning until now and up into the future to make the location and build it back better. As a scientist, as a statistician, when I first heard about the earthquake occurrence, the first thing I thought about was the magnitude. So how big? So that is what the data scientists will need immediately when a crisis situation. Talking about earthquakes, when an earthquake happens. So I thought, where? Okay, that is the first question. I need to have some information about the geographical location, where it happened, how big, what was the magnitude. So these are the numbers I need to understand and produce. I need to use to see how big the impact would be. And I asked myself, when the news started coming up, I said, okay, 100 people died, 20 people, 200 people, 300 people. So there was an increasing trend in the number of casualties. And when the daylight came, because it happened 4 a.m., almost 4 a.m. in the morning, 4:17 a.m. And when the daylight comes and the drone images, okay, another data that scientists needs to collaborate with, aerial image views are very, very useful and crucial, because you can see what happened in the ground. And you can have some estimate of the damage. It's a scientist's job. So how many buildings collapse? What was the amount of the damage? How wide? How big was the location, geographical location? So what are the urgent needs? What people needed in the first few hours, first few minutes? So we needed real-time data. As a data scientist, I looked for real-time data, accurate data, and trustable data. So I could see what's going to happen, what needs to be done in the next few hours. So people said, okay, roads are blocked. How would they know which location, which route, which alternative route I should take to enter the access to the damaged areas? So we need a real-time, accurate, trustable data. We need a network of scientists, because I'm a statistician, but I'm a policymaker too, so decision maker too. So I receive data from the field. I observe data myself from accurate resources, if possible, as much as possible. As much as possible is a keyword during a time of crisis, because you never can have 100% correct, accurate data. There will be always a deviation, say 99%. Maximum level of accurate data. And I need to use this to, if I'm a pharmacist, I need to use how many asthma or cough patients are in the field who need immediate medication, because there will be no chemists across the earthquake area. So I need to know, as a chemist who is not affected, by the way. Scientists are also affected if they are in the earthquake location. So other scientists, that is why network of scientists are crucial. So they need to understand what's going on by different types of data. Data can be ordinal, nominal, ranked, discrete, continuous, mixed, qualitative, quantitative. You can improve it, categorize. There are different types of categorization of data that scientists will be really much interested in if a crisis happens. And we need to, our job as a data scientist or statistician, to understand the data, have the data, find the data first, reach out to the data, use the data, analyze it, and make it understandable for everyone to benefit from the results. There's an example we use in the project, UNESCO project, Data Policy in Times of Crisis project, like 6 young computer, like similar to what Nana did with his students. 6 young computer engineer students from METÜ, Middle East Technical University in Ankara, in 17 hours, just after the earthquake, developed a system where even an individual, like a person affected in the earthquake region, but still alive, so could function, and myself, say in Ankara, we would be at the same time able to enter data to the system where most of the needs occur in the location. So what type of needs? Where a chemist, a portable chemist truck is there, so you can go and pick your medication there. Where are the number of the cranes available? What is the number of the cranes available in that location, blah, blah. So they created a system interface in 17 hours, 6 volunteer young generation university students. They can come up with a system which was shared widely within the community, and it was trusted. So policymakers even consulted to the website. Next slide, please. Stephanie. Data scientists, like myself, we either need to generate the data if we are not in a crisis situation, find the data, create our own data, and or use it available from local and national resources, NGOs. As I said, we need a network, data networks, repositories for previous events, and during the times of crisis, it is hard because who's going to collect the data, whom you can trust, where you're going to have the data. These are all complicated issues to think about because this is an extraordinary period of time, so everything needs to be planned accordingly under extraordinary circumstances, not normal circumstances, but crisis situations are extraordinary circumstances where things will be really, really harder. So we need to be able to sometimes go there and collect our own data at the time of crisis, which will be really, really hard, even if it's a conflict situation. Imagine earthquake in a conflict and a climate drought. So there can be multiple hazard cases where you need to be able to derive some data. That's a magical event to happen. Data scientists should always connect with the decision and policymakers so that they're on the right track to produce more results. One example is social media is one data source that you receive data during times of crisis, because I received so many WhatsApp messages giving me the location of the rubble and asking for help to direct the search and rescue teams to that location, so geographical location. Because I'm not a software person sitting in the disaster and emergency management headquarters, so what I could do as a person only, I took my WhatsApp message and passed the address location to the teams in the AFAD headquarters, to the disaster emergency management teams. But I couldn't follow what happened afterwards. If they entered the data to the system and the system diverted the search and rescue teams, that rubble location immediately. So there was no option to follow up. But this is how the data, vivid example of how data comes from the field in times of crisis. They give you the rubble location. They say there are 3 disabled, 2 female, 1 child under the rubble, and this is the address. Please pass it to the search and rescue team so they can come and search, save, and rescue us. That's like, it needs to be done like in 10-15 minutes, less than an hour. It's not like a huge period of time you have. So we need definitely data scientists who can act quickly, pass the information to decision and policymakers so that they can go and help during times of crisis. They need to have, data scientists should have connection with the community to understand from the needs from the field. This is exactly what I said. So I need to, they told me the needs from the field, from the community, and I passed it to the practitioners, operators, and policymakers so that they could help. But there needs to be a link to follow it up. That was a gap, what I experienced personally. And a data scientist can support decision and policy-making processes in times of crisis times, before, during, and after a situation, after a disaster occurrence, with infographics, which is very effective, tables and figures, because none of these people, the bureaucrats, they never have time to read everything, 100 pages of report. Even if you can produce as a data scientist 100 pages of output with super functional models, they will have no time to read it, understand it. They'll just have 1 page, 5 minutes to read 1 page brief information, which will be exact tablet information so that they can understand and use in their policy-making, decision-making processes. This is why we need to bring data scientists and the policy decision makers hand in hand. Otherwise, there will be always breaks in the chain, so that at the end of the day, the people who suffer in the field will be worst affected. Thank you.
Thanks, Burçak. Alison, you put a very interesting comment into chat. Did you want to say anything more about that?
Yes, very happy to. Hi, everyone. So I know
Thank you.
some of you, and it's nice to see some others. I just wanted to say, because Burçak had been saying some really fantastic and insightful things about being a data scientist and the perspective of the person in the role of the data scientist. And although that's not a role I've ever taken in times of crisis myself, I did speak with somebody who had a very interesting story, again, about the pandemic. This is related to the earlier speaker, but about how he found it on a sort of a personal level, very different from his normal job in data science. And when you're dealing with things in this matter of urgency, the way he became almost an interpreter for the people that were bringing him the data, and then he had to restructure it all in a way that was a sort of a single format. And there were often missing bits and gaps, and he'd have to go back to and iterate with the people providing the data. And they were all doing this on a best effort basis, often volunteering large amounts of their time outside of their normal roles. And it was just really interesting to hear the difficulties, but also the sort of positivity with everyone sort of pitching in together. But the point I made here was particularly about how it seemed that they really seem to be a critical node in times of crisis, the data scientist role, because they're getting all of the different sort of raw data and having to deal with it and before they can move it on. And I just wanted to sort of raise that perspective, because what Burçak's doing is really interesting and pretty amazing.
Thank you, Alison. Burçak, did you want to say anything more to that?
Yeah, I totally agree. It is a complicated scenario. It's a complex system. So data scientist can be a perfect data scientist, policymaker can be a perfect policymaker, but you need to connect them in the right way, right time, right amount, and with right decisions. You can never follow. So nothing is guaranteed. So there needs to be a system developed, manual or automated system. I don't know how we can think about it. It's an open debate discussion. But there needs to be a way to bring those people together. There's also a comment from Bruno in the chat, Stephanie.
Yep.
Shall I take this one as well, or will you?
Bruno, yeah, sure. Sure, Burçak.
He asks, like, some data doesn't come from scientists, but from environmental associations. This is what we exactly say. Like, that's why, I mean, the data source should be trusted. Data source should be accurate. Data needs to be correct form so that a data scientist can use it. Otherwise, a data scientist will spend hours to make the data manageable and to be able to analyze it. So it is hard. How to coordinate the data collection? So you need to practice it in advance, I think. So this is the before time. How to coordinate data collection from a non-professional actor is something to do what I think we need to do before event. So that is a matter of practice. That's a matter of drill. That's a matter of tests and training and educations, which needs to take place before, not at the time of the crisis, I think.
Bruno, did you want to add anything to that?
Yeah, I think indeed this is all the point of a crisis is anticipation, and so a big preparation needs to be made beforehand, and it's even more critical, as you have exactly precised, that we need to coordinate all the actors beforehand. And this is the biggest challenge, because when we deal with citizen science, the practice are very heterogeneous in terms of data quality, about protocols, etc. And so it's a bit a nightmare. And also there is no somehow federation that collect properly the data server, I would say. And so people even don't know where are the data. it's a bit a mess. So indeed, a huge work has to be made by anticipation for this type of actors.
Thank you. Graham, you also had a similar question for Bochak. Would you like to speak to that, or would you like that to be taken as read?
Yeah, sorry, my just the children are getting ready to go to school at the moment, so being off camera.
That's all right.
Yeah, it's a similar question, really. Like the challenge that you identified, Bochak, was yeah, to really understand this issue about like this connection and the ability to disseminate these large amounts of data. Really, and I know I'm asking you to really provide the answer as well as a question here, but do you think that this is more of a behavior change issue? Is it an actual policy change, or is it something where it's actually like a technical problem that can be solved? Like, could AI actually help to bridge the gap between this kind of dissemination of data into information to decision making?
Okay, thank you. I think it's all of them together. It's behavioral, it is awareness. I'm personally very much aware and alert, so I check data, but it is my job, but not my neighbor. Like he doesn't or she doesn't have any information what to do. So that is a individual awareness. It's an issue of behavior from individual to nation, local, regional, global, and national, whatever, like with the chain that we can think of. And AI is like Francis is here, he likes the word AI, it's his magic word. So AI is a tool that where we can maybe use, but again, it will be very high tech, not for ordinary citizens in the like a person who is, say, I don't know, very old, disabled, alone. So it's not, AI is not for him or her, but there needs to be a mechanism which brings all together. So it is complicated. I can't say it's very easy and like I can come up with a quick solution and answer. We need to think about it. Thank you.
Thanks, Bochak. I think we'll hand over to Jackie now. So I'll stop sharing for the third lightning talk, if that's okay.
Great.
Yes,
Hey,
wonderful.
Stephanie, you can see my slides?
Yes, all good.
Hi, everyone. So as I introduced myself before, my name is Jackie Stevens. I'm an Associate Professor of Public Health at Flinders University, which is located in Adelaide, South Australia. So I am a person who uses data. I'm a data scientist, but I also wear another hat as a volunteer in the community. So I'm going to be talking from the perspective of someone in the field who needs to be able to access the data and the policy that both the previous speakers have spoken about already. So for those of you who don't know, in Australia we do typically start by acknowledging the land on which we are. So I'm currently based on the traditional lands of the Kaurna people. They're the traditional custodians of the Adelaide Plains region, and I just want to pay my respect to their elders, past and present, before I start. So for those of you who don't know where Adelaide is the capital city of South Australia. And I'm going to be talking today about some community engagement work that I was doing during the 2022-2023 floods. So Adelaide has a river system, or is at the end of a river system called the Murray-Darling river system. And you can see here on the right hand of your screen where all of the rivers connect and basically flow down towards Adelaide. So when there was a flooding event in another part of the country, it actually will impact on the Murray River, which runs across into our state from the other locations. So this is a major river system in Australia, and it is a huge water supply for Adelaide and the surrounding towns. There's sort of two main townships along the river in our state, which are Renmark and Murray Bridge. And during the period from November 2022 through to February 23, there was a major flooding event. It was the largest flood that we've had since 1956. And it peaked at 186 gigalitres of water flowing across the border from Victoria, which is this state here at the bottom southeast of Australia, flowing across into the South Australian river system. And so this river system actually has water that's flowing from 3 different states, converging together and then coming across into South Australia. And so requiring, you know, coordinated effort across the states to actually provide clear information to us about how much water is coming across. So this flood event was quite different to some of the other crises, which are quite sort of catastrophic at an immediate time. This was a very long, protracted event where we knew the water was coming because there'd been flooding interstate. And so people were watching this water flow down the river system and sort of had this, you know, long period of time to sort of see this water coming down and slowly impacting on their community. The reason that sharing data between the different agencies was so important was that we needed to have a really coordinated effort about when people could evacuate their homes and trying to predict where the flooding was going to happen. And so in the end, we had 4,000 hectares of agricultural land impacted and 3,500 private residences flooded from this flooding event. But throughout the entire time, the government was sharing data with the community about when to expect the peak, what the peak might be, where the floodplains was going to be, which floodplains were going to be impacted, to try and give people enough time in the community to actually prepare and evacuate their homes. Now, in my role as a Red Cross volunteer, we actually had a response which was coordinated here in Australia, in South Australia. Red Cross is coordinated through an activation from our state government. And we set up relief centres and so that people had a source of truth, so they knew where to find true data. They could come to us and get advice about where to evacuate to, when the flood might come in, and how to get relief. And so having timely data which was accurate and from different sources was really important when we're on the ground working with these communities. So each day, throughout the flood period, the government was giving out reports which we knew was the source of truth around water levels, flow rates, which bridges were going to go out of work, function, where the levee banks were being implemented to try and prevent flooding in some of the agricultural regions. So at the peak of the flood, this is what we were faced with. So normally there is actually a river system here with an island in the middle. We can normally see banks on the left-hand side. You can actually see a river. The river is up over a road to the left-hand side of this image. Normally where there are trees, there's actually land. You can see some land that there is actually part of some flow down that's coming down. So you can actually see a lot of debris being floated down the river. You can, in this image, you can see an island that's actually in the middle of the river completely flooded. And this river has a lot of houseboats on it. A lot of people retire from Adelaide and live in their houseboats. Those all were, put at risk. So there's a lot of people that had to get emergency relief and emergency housing. And so we really needed to know when, where, what, and how this flood was kind of progressing over time. And the data had to be responsive to the changing levels of the water, the changing flow of the water, the changing conditions. Of course, this was happening in the middle of COVID, so we had to take into consideration where to put people in relief centres and relief housing because of COVID. We had people with pets, we had people with livestock. So we needed to have accurate data, timely data, and responsive data coming to us from our emergency services, from our government, from our community agencies, right across all of the policymakers and the data analysts, through to the NGOs that were working on the ground to help support people through this particular crisis. This particular image here is a road that connects part of a township to another location. As a result of this flood, it actually meant that people had a 1-hour diversion of driving to get to the main township where their food, water, doctors' clinics are. This particular reserve to the right-hand side is somewhere that I take my children for picnics. So I'm on the ground in this area as a member of the community. My auntie's house is actually up on this embankment on the left-hand side. So I have family members who used to live in this area. And this area here is a picnic spot completely underwater. And this is not even at the height of the flood at that time. So this is, you know, a severe flooding event. This is the main street of a township, and you can actually see that they had enough time because we had timely information given to us accurately. We were able to, the local council was able to build a wall to protect a lot of heritage buildings that actually sit on a low-lying piece of land here. So that levee there on the left-hand side, the water is actually right at the top of that. And you can see that they were able to protect the other buildings on the main street, which are all heritage buildings, and some of those buildings are providing accommodation for people. One of the big issues we had though here is actually that the water was so high that sewage systems weren't working. We had to bring in emergency toilets to the community. So there's a lot of kind of factors impacting on the health and safety of people. We were also needing to liaise with with the health department, because we then had problems with contaminated water. We had problems with mosquitoes and things like that as well. So there's a lot of agencies relying on accurate data, timely data. So there's a few places, this is just for interest's sake. So there's a few trees along the river where we mark our floods. It got to higher than this 1956 flood at the in January of 2023. So, you know, this was the worst flood we'd seen for a long time. You can see houses here underwater. That there's actually a road down there you can't see. Communities were cut off, and you know, we are now moved into, it's been 12 months or over 12 months since this flood event ended, but we've moved into the cleanup recovery phase. So we still need to have accurate information that we can provide the community around how to deal with removing damaged buildings, how to deal with contaminated water, how to recover and respond to that. And as I said, I was part of the Red Cross response to this. So the data that we get from the data scientists and from the the policies we get from the policymakers are really important when we're on the ground working with communities. These are some pictures of me in the recovery and response centre. So we would get people coming in, asking for information, and we were able to provide them with accurate information because of the data scientists and the policymakers giving us timely, accurate and correct data on a daily basis. Yeah, so that's me out in the field. And just as an interest in my actual work job, if any of you ever come to Adelaide, South Australia, please look me up. I get to go out on country. This is some of the beautiful locations where I do my data collection across the South Australian landscape. Thank you. That's it from me.
Thank you very much, Jackie. You're making me jealous. Any questions or comments for Jackie? Nana, I think, and then Burchak.
Yes, Jack. So Jackie, that was an incredible experience, I'm sure. So what did you find the similarities and the differences of your experience as a researcher, data scientist versus somebody on the ground?
Yeah, so I have a unique position in my volunteer role in that I get to sort of look at things through a lens of both a volunteer and a data scientist. And working as a volunteer in an NGO, you know, we do have challenges in getting correct data, in getting timely data, and the data changes over time as definitions change, as an emergency evolves. We saw that during COVID and, you know, changing requirements from governments. We do work in a very kind of responsive way. So we are, every single activation that we have as an agency is different. And the paid staff, I am a volunteer, but there is a team of paid staff in the emergency management team. And they do an amazing job of collecting the data that's needed to be able to facilitate the support for our community here. But they do rely on having accurate data given to them, or being able to access accurate data from the data scientists in the government agencies, and having clear policy given to them about the particular event that's happening. And we access that data from not only the health departments, but from the meteorological departments, from, as I said, with this particular disaster, from our other support agencies and emergency management agencies across the state. So it's a collaborative effort, but it does mean that everyone needs to be on the same page. If you have different information coming from different agencies that's telling the community different information, it actually creates a lot of distrust. It impacts on the community's mental health because they're uncertain as to what the truth is in terms of the crisis. And it can actually make it quite hard to manage on the ground, because if the community is feeling like information is being withheld, or that the information changes too much from week to week, they become a bit distrustful of governments, distrustful of the data, and uncertain. And it can really impact on the community's ability to build back from the crisis, their resilience to the crisis. And particularly in this flooding event that I shared, it was a very long event, and we actually had a lot of mental health impacts just from the anxiety of worrying, like, when is this flood going to hit the highest? How high is it going to be? A lot of people didn't know if their houses were going to be safe. And some people thought their houses would be safe, and the flood got higher than we anticipated. So they did lose property and, you know, things that they, you know, held dear. So it can be, you know, really important to make sure the data is correct and given in a timely, transparent way, so people don't have those added mental health impacts, you know, which can actually continue on for many years afterwards, and is part of our ongoing recovery efforts in the community at the moment.
If I may just say something on that. So one of the things we've seen with bushfire data, for example, also in Australia, is that the different states had different ways of describing or naming things. So for example, the fire danger rating between New South Wales and Victoria, two adjacent states, basically is different. So if a fire moved from one state to the other, all of a sudden it had a completely different fire danger rating, and that has created problems as well. So there's that added issue as well.
Absolutely, Stephanie. So when, you know, earlier this year, so this is 12 months after the floods that we had here in South Australia. And of course, that flooding event was prompted from floods interstate. So there'd been the floods interstate, the water had flowed down to South Australia over time. some of our volunteers this year were then either had been to those earlier floods before this event, or have been to other floods that have occurred since in other states. And the terminology is different. The way that each state handles the flood event or a bushfire event, the way the data is shared is different. And so those inconsistencies can also add to difficulties on the ground in addressing the challenges that the community is facing. So there needs to be a consistency in how we use the data, how we report the data, how we share the data, so that people are all on the same page. Yeah.
Thanks, Jackie. Bochak?
Thank you. When you showed us the photo where streets were cleaning by the community, number one, how much after this happened from the flood, and how about the population? Is population an important variable to respond and for early warning and recover? Because if it's a small town, maybe things are easier. I'm just thinking loud, asking you your opinion. If it's a small city with a small population, that should be manageable more easier, or if it's a large population, metropolitan, where there's a flood of size 1 million, say, would that be more difficult, you think?
Yeah, so these townships are quite small in comparison to what you might have in Europe, for example. But the issue that we have is that they're quite long, like quite far away from Adelaide. So Adelaide is the main metropolitan city in South Australia. South Australia is a very rural, regional kind of space. We don't have any other big cities in our state. The other towns are quite a long way away, so people have 4 to 5 hour drives to come down to Adelaide, and they may not have anywhere else to evacuate to because of family or community connections. And also the other thing in South Australia particularly is we're very flat, and the floodplains around the Murray River are actually quite flat. So when it floods, the water just goes out across all the agricultural lands, and it actually impacts on supply chains. It impacts on crops that the farmers rely on for their income. So there's some farmers who lost all of their crops for the year, so then they've got no money. So you have those kinds of flow-on effects to people's livelihoods. So they are smaller towns, but still quite difficult to evacuate, and you don't have anywhere to evacuate people to. And there's quite a lot of people that live along the river. So there's not really any other townships away from the river. All of the townships are along that river system in South Australia, as a general rule. I'm being very generalised here. But.
Okay, thank you.
Thanks, Jackie. If there are no more questions or comments, we have about a good 15 minutes left. So I was thinking we had a couple of suggested questions for discussion. Let me just share my screen again. So these were some questions we thought of. Are these of interest to people in the room? Do you have any other questions in this context that you would like to discuss? Thanks, Bochak. Sorry, I'm just trying to manipulate all my different Zoom windows here. Okay. So I actually have a question probably around the third item here, the data gaps for people on the ground. And sorry, Jackie, I'll be grilling you again. So you said you got quite a lot of information from the state agencies, and basically from where you needed it, you got the policy that sounded like it was all working okay. Were there any gaps or any areas where you say, well, I wish I could have had that information, or I wish I had that information in a better shape or something like that?
There's always room for improvement, Stephanie. So throughout, I mean, whenever there's an event, there's always a incident management team, and each day or semi-regularly, that particular team is updating the report. So regardless of which NGO you're with, or whether it's Red Cross or some other agency on the ground, in another location during a crisis, you get your kind of briefing each morning of like, this is what we know today. And that information that goes into that particular briefing document has to come from somewhere, and it has to be reliable. And so, that really, if you're going on the ground to support people or evacuate people or build levee banks or distribute food, whatever your NGO on the ground is, even if it's with, government on the ground, you need to have the correct data in that briefing document. And sometimes, sometimes things change over time. A definition changes or more information comes about, and it can be a bit challenging when you suddenly get told, oh, no, we're not doing what that information you got told yesterday, we've changed it for today. And so it does really require people on the ground to be quite flexible and adaptable, because these events are not static. They are ebbing and flowing as more information comes in, as the crisis changes. It's not just an event that's happening and it's done. These crises, doesn't matter what crisis it is, they ebb and flow. They have changing states over the duration of the crisis, and they do move from that immediate needing to address the issue to that recovery phase. And the information has to be correct, and there's always room for improvement, and we're always trying to learn from it and improve, so that the next time there's a crisis, we are a little bit more prepared. We have improved on our data sharing. We've improved on our ability to identify what data we need, but there's always gaps. And it's hard to know what those gaps will be sometimes.
And once you plugged some gaps, you probably find new ones.
Yeah, honestly, I feel like that is certainly the case, that every crisis is different, and no matter how much you try and prepare, there will be some gaps. And I think that's just going to always be the case. We never quite know how big the crisis will be. No one at the beginning of COVID could have predicted how huge it was going to be, or how protracted that event was going to go on for. We're still actually living in the crisis at the moment, but we're in a different phase of it now. And the same goes for bushfires or floods or earthquakes or any other crisis that's happening around the world.
Thanks, Jackie. There's a question from Alison. Alison, did you want to speak to that?
Thank you. Like you, I have to often figure out which buttons I need to push. Yes, I just is something that occurred to me while you were all speaking, and it's not necessarily one that I feel we have to address at this moment in time, but I suddenly thought about all the discussions we've been having around data scientists. How would someone, like, I don't know that my friend who was in genome sequencing and sequencing, I don't know, bacteria or something, how would he would have probably never anticipated he would have been involved in the sequencing during COVID, right? And so this was thrust upon him and many other people, and they performed admirably, but he would never have thought to prepare, right? And I know a lot of what we're talking about in with regards to times of crisis is preparation, because that is going to be really helpful. So how would a data scientist, maybe it's a spreading awareness issue, maybe it's a fact sheet checklist issue, possibility. how would data scientists in a particular field know whether or not it's even something they need to think about? That's just sort of a thought, that's all.
That is a very good question. And I mean, I can't really say much to that, Jackie. I don't know if you can.
I think one of the, and Burchak's just left as well, should probably have some things to say to this too, but I think one of the things that policy makers and data scientists can do in the preparation, in the being prepared phase, is making sure that, you know, they're connected, that we know about each other, that we're working with systems that can scale up if they need to be, you know, called upon in a time of crisis. We certainly, you know, as I said before, had no idea of the scale of this particular pandemic at the start, but the systems that were put in place at the beginning, and some systems that already existed, were able to scale up and address the issues. And then the gaps that were becoming apparent, people worked very quickly to develop solutions on the fly, as it may be. But, you know, we're trying to learn from that by having those systems in place, having an understanding of who is doing what, who's got those skills, who is based where, and then if there is a crisis, we can call on those people. We can bring people together to address those questions that arise as the crisis unfolds. So it is challenging. That's certainly the case, but I think in the preparedness, it's making sure people are connected. We know what we're, you know, who's doing what, and we're not working in silos. I think that's part of the issue we have a lot of the time as scientists, is that we sit in our room and we chug away at data analysis, and we're living in our little silo, and we don't really connect with other people across the different disciplines. And I think that's really important as well.
Yeah, I agree. The connectivity is really important, in having a sort of a network of data scientists in the same, maybe through the RDA, through a professional society. This is the kind of thing that to build awareness, because you know, I believe when the scientist I talked with, he said people were giving server space out of the kindness of their hearts. They were finding bits where they could put this data, and they were asking around and going on the cloud where it was all, you know,
ad hoc.
Ad hoc. That's a good way of putting it. And then I think about it's likely if someone doesn't realize they're in a field that might have this happen, you know, they'll have to do that all again, despite the preparedness of people who are aware, like who are now realizing, oh yes, there might be more sequencing that needs to happen if a new pandemic, or if this one comes back stronger, or, you know, gets stronger. And so it's more a question of like, how can, if someone's interested, if someone hears about, you know, data scientist role in time of crisis, how do they find out? Because they'll likely be not at a very senior position in their institute. How can they then go and tell people, well, actually, we need to pay for this extra spare capacity just in case, or we need to put a preparedness plan in place when they're not necessarily super high ranking in an academic institution, which can often be a barrier. I think what you're saying is perfect. I'm not saying you need to provide an answer now or anything. It's just, it's an interesting aspect. I actually haven't.
I was going to say, if you can come up with an answer, that would be great, because I have no idea how you do that either.
There's something to think about as we're working through the you know, the stuff here in the working group and in the UNESCO stuff. Don't know.
I think the important first step is to acknowledge that these are really difficult you know, things to kind of predict, and that it is difficult to know exactly how to you know, how to set up the answers to these questions. How do we set up the systems to try and provide solutions? But I think if we can at least just start by acknowledging that it's difficult, you know, that's the first step. And then, you know, it opens up these conversations. And I guess that's where, organisations like RDA, the Australian Research Data Commons, who's, Stephanie and her team who are chairing this session, those kinds of agencies play such an important role in kind of being the connectors. Absolutely. And knowing who's doing what where. It is really important. Because if we have to do it again, and let's face it, we will at some point, it's not a case of if, it is a case of when, in terms of another pandemic or, another earthquake, another flood, another whatever it might be, rather than trying to do it on the fly, ad hoc as we go. It's so important to have some of those systems in place beforehand. And we know that even more so now because of COVID.
Thanks, Jackie. Any further questions or comments? Given that we're nearly at time, I think if you have additional questions or anything, please put them in the collaborative notes and we will read them and try to answer them in the document. Other than that, just as a wrap up and next steps. So again, here's the link to the group page. Athena, if you were able to put that into chat again, that'd be great. If you haven't joined the group yet, please feel free to join it. And that should keep you informed about everything that the group does and upcoming meetings and things like that. We do hold monthly working group meetings, and I should know when they are. I think they're on the first Tuesday of the month at 8 a.m. UTC, I think, but I could be wrong there. But in any case, given the current transition to the new website, if you are interested in joining the monthly meetings, please contact Athena or Ryan, and the contact details are there, so we can make sure that you actually get onto the calendar invites for the meetings. And other than that, I think we will hopefully have the survey very soon. If you're interested in helping us test that, or if you would be interested in providing contacts for us to send them the survey to, let us know. Either in the collaborative notes or via email. I think you can email Athena, or I can also put my email into chat. And other than that, thank you very much for attending this session, and we hope to see more of you. Thank you very much.
Thank you very much, Stephanie, and thanks all. Really interesting discussion and talks. Certainly learned a lot myself, so really grateful for that. To reiterate what Stephanie said, please do feel free to sign up for the working group on the RDA website or contact us, and we will make sure to keep you in the loop. So enjoy the rest of the plenary, everyone, and hope to see you around in some of the other sessions. Goodbye.
Bye. Thank you very much. And thanks very much, Athena, for all your help.
Thanks for taking the lead, Stephanie.
It's okay. Was the meeting recorded?
Yes.
Yes, okay. It is.
Do you stop? Can you stop the recording at this point, or have you already done so?
No, I will stop it and then we will edit accordingly, just making sure. I will also save the chats. Yes.
Excellent, thank you, because I always forget that. If you could just append that to the collaborative notes document, that would be fantastic. Thank you so much. And
okay.
thanks really for all your help. That was great.
Of course. So we'll be closing this meeting room now. Thanks a lot, everyone.
Yep. And
Bye.
Thanks very much, Jackie. That was fascinating.
Thanks, Stephanie.
Indeed.
Thank you.
Thanks, Athena.
Bye.
Bye. Bye.